And Professor Yoav Yinon, from the head of the Fetal Medicine at Sheba Medical Centre, joins us here. Professor, thank you so much for coming on this evening. Firstly, tell me about some of these incidents that you've encountered. You are part of this study. What have you seen?
So the two major observations is one, that during the pandemic period when mask wearing was obligatory, the hemoglobin level, the red blood cell production was higher in patients who came for delivery compared to the same period of time a year before or 10 years before. So this is one major observation. The other observation, which I'm not sure is associated or connected, is that we had less premature delivery, less than 24 weeks during the pandemic period, during this 3-month period, compared to the same time period a year before or 10 years before.
Very interesting story. Tell me, how concerning are these findings for you?
It's actually encouraging. I mean, we had better obstetric outcomes. So first, the fact that the patients who came for delivery had higher hemoglobin is a good thing. We want the patient to have a good hemoglobin level. And the most important observation that is actually encouraging and maybe surprising, that we had less premature deliveries during that time period. We don't know what's the reason. Is it related to the mask wearing? And because of the masks, there's less oxygen. And for some reason, less oxygen is actually a good thing in pregnancy and maybe prevents preterm birth. This is an hypothesis that we have to check. But eventually, and surprisingly, we actually saw that this during the pandemic and during the mask wearing period, we had less premature delivery, which is a very serious complication that we don't know how to prevent or treat for dozens of years.
And Professor, finally, there's a lot of information out there, and I'm sure it's a very daunting time for many expectant mothers. What is your advice to them?
My advice is to keep on their regular lives. There's nothing, we're probably here in Israel over the pandemic. And my major advice is to get vaccinated. And we've seen here that the vaccination in pregnancy, first of all, is very, very effective in preventing disease and very safe. So this is my major advice, is to get vaccinated during pregnancy and before delivery.
All right, Professor, it's been a pleasure having you on. Thank you so much, and good luck for the rest of the study.